All right, so first off, I'm not a doctor. I'm just a baseball player, a retired one, and I throw slow. So that's that. But I do want to talk about this today because Dr. Heenan posted a really funny Instagram meme the other day. He responded to my caption, or my comment, by the way. Just going to throw that out there. It's pretty cool for me. But, you know, he posted a meme, and it was basically like, light roast me. And so one of the guys in the meme was like, you got surgical procedure done. You had no idea what it was. You just clicked the panic button. And that is a real thing. So I want to talk about it today, kind of share a little bit of my insight in my career, kind of what happened to me. It took me 9 months to make my decision. I had an MRI, it said 9 to 3 o'clock, tear posteriorly. I did not want to get cut open because I was going into my senior year. I was throwing hard, it hurt, but I didn't want to restart. It was kind of a rough time. I knew how long it was going to take. Side note, I'm not giving medical advice, but it did help me. I am pain-free, throwing slower, and it took 15 to 16 months to get pain-free with 10 anchors. But my daily life is normal. It's very nice mentally, just to kind of just be like, it worked, I'm okay. I don't regret the decision at all. Couldn't turn a steering wheel. Personal note, couldn't really put my arm around people. That was kind of rough. Hugging was kind of hard. Sleeping was a little hard. So I'm happy that this happened, but I do want to share a little bit of advice. So I want to take a step back and kind of run through it because I think, I get a lot of DMs. I got a DM today from a guy who's 2 days post-op, has no idea what his procedure was. He's very, very, very young. He's in high school, and he doesn't even know when to start PT. He was like, okay, what do I do next? I was like, all right, well, that's not good. You should have an outline before you do this. I've had literally probably 75 to 100 people DM me saying they don't even know what anchors are and they got cut open. Sometimes you don't need them, but they don't even know what happened. So I do want to talk a little bit about what this is. So this is my little picture here. This is the labrum. It's this fine line of cartilage. It's like this donut surrounding the capsule. It helps everything kind of glide smoothly, buttery, so that you're not having a lot of pain, right? Now this can tear, right? So there's different ways that this can tear. Acute or traumatic injuries, the collision injuries out there, versus chronic, which is more of baseball player tear over time. We call this fraying. So in fraying, the labrum, imagine a rope, right? A thick rope, and then you take scissors and you kind of chop at it. The strings of the rope kind of start fraying. These are those micro tears that might show up on MRIs. That's fine. There's not a lot of pain that comes from that, but eventually, over time, this tear can evolve and ultimately pain will arise. So that's what would be referred to as, a pitcher just in constant pronation, constant deceleration of the shoulder, slamming into end ranges, and ultimately the tear will happen over time. Acute traumatic, that's more, you're the football player out there, you're in a car crash, bam, smashed, just it hurts a little bit, dislocate, stuff like that. So those are the two different types of tears. Typically in football players, they'll put a lot of anchors in. I'll get to that in a second, because you don't really have to get, overhead flexion or extension and this wicked ER. So they'll just kind of lock you down because it's fine. The pain's going to go away. Anyways, this is the labrum. And then this is the long head of the biceps tendon that kind of runs through from the humerus up into here. Kind of reminds me of a little letter Q. It's like the labrum's that, and then there's a little thing sticking out of it. So this can tear, and that's what's referred to as kind of a slap tear. So they'll put a little anchor there. Fix that up. A little bicep tenodesis is what that's called, if you've ever seen that big word. Now we'll talk about what the anchors actually are. So these are called sutures, fibers, strings, knots, a bunch of different words. I've always called them anchors, even though they're not really metal. It's like a fiber. So first off, I have 5 scars. So a lot of people think the anchors are the scars, the holes. That is not the case. So they will go through. If this is your shoulder skin, they will poke through it. I had 5 little holes, and some of those holes are for cameras, to kind of go in like a little ship in a bottle to really understand, what's happening inside the cartilage, to really see it. It'll display on a TV for the surgeons. And then they'll go in, they'll start picking at it, and then they will take a needle, basically, and they will lift the cartilage. They'll lift it up, and then they will disperse like a little fine lining string. That's the fiberglass. After they lift it, they will put the cartilage back down, and then that string will knot, and they will tie it. So this is what I wanted to get into. So the anchors itself, if my shirt is the labrum, right? My shirt is the actual cartilage, and I rip this shirt, whether it's chronic or acute, and I take those little sutures and I go and I tie it surgically, and I put 5 or 7 of them and I tie it. The next time I go to put my t-shirt on, it's going to be tight. It's going to be uncomfortable. When I go to throw, when I go to make the throw, it's going to kind of rip against it. It's going to hurt, right? It's going to cause a lot of discomfort. So that's the importance of the tightness of which. So if you're a football player, you get 5 to 7 anchors. They're going to lock it up, right? They're going to make sure that that doesn't move, because you don't have to be mobile there in a lot of those positions in that sport. But in baseball, they're going to keep that lift of the cartilage that I was talking about. They're going to lift it really gently, put it back on, and kind of tie it a little, not too tight there, right? So that's that. So the problem, with tying it down is it prevents range of motion from occurring, without a lot of pain. So I have always referred to the labrum as concrete. So what I mean by concrete is you have to stir it. You have to consistently push yourself into the end ranges of motion and keep stirring that concrete, or else those sutures are going to freeze and you're going to get locked up. So in my physical therapy process, this was well before I started with DAC. I didn't start with DAC until I was 9 months post-op. Made my first throw like 5-6 months post-op, for context. One thing I did right was I was in PT locally 10 hours after I got surgery the next day. 10 hours in. And I was still like, whoa. And they were taking my arm and they were moving it themselves. They were getting it moving out of my sling, because you got to stir it. You can't get it, let it get locked up. So I hope this cleared up a lot, of what's happening. I didn't talk about decompression. I stayed away from the rotator cuff today. I just wanted to talk a little bit about the procedure. This procedure has changed a lot anatomically, scientifically in the surgical community. Props to them. They are absolutely fantastic at what they do. It was a very tough process for me, but I'll tell you what, man, it did work. I'm not telling people to do it, but it did work for me, and I'm very grateful for that. I'm grateful for my physical therapist. I'm grateful for Brady at DAC, thankful for Tread Athletics, my parents, Charlotte Baseball, obviously, Architect Sports. Crazy amount of people that I'm thankful for, that after this procedure was completed, I was ultimately in a lot of pain, but they got this to clear up. I got my range of motion back, and I'm fine now, So I just kind of wanted to touch on that. Going to make this video. I'll send this to a lot of people to kind of explain, what's going on in the future.